Hey, Mr. JD. It's Cheryl again, your nurse. I've been with you all day today. I know you're getting ready to leave, ready to bust out of here. How are you today? You doing okay too? We're working on your discharge paperwork as we speak, but I wanted to go over your medications, new and old, with you and your wife before you leave. We'll start with the new medications. We'll start with the medications that you're familiar with, the ones you were already taking at home. We'll start there that way. And I was just gonna make sure you're gonna drive him home, correct? Okay, and you'll just pull up at the front lobby and I'll push him out in his wheelchair and we'll get him loaded into the car. Okay, just wanna make sure he wasn't gonna try to drive himself. Okay, so we'll start with the Synthroid. You're gonna have 100 micrograms daily by mouth. Should be one that you recognize, correct? Maybe called levothyroxine too, because sometimes we get a generic brand. Okay. Synthroid is a man-made thyroid hormone that is used to treat a condition called hypothyroidism in adults, children, including infants. It's meant to replace a hormone that is usually made by your thyroid gland. This medication is expected to increase your energy levels, help stabilize your weight, your sex drive may improve, you may sleep better, pain in your muscles and joints may go away, and your mood may improve as a result of treatment. Some common side effects with Synthroid or levothyroxine are fatigue, increased appetite, weight loss, heat intolerance, fever, excessive sweating, headache, hyperactivity, nervousness, anxiety, irritability, emotional lability, insomnia. If any of these symptoms occur continuously and don't go away, you should notify your doctor. Some foods to avoid are foods that contain soy and cottonseed meal, and they can make Synthroid less effective. Walnuts, grapefruit juice, and dietary fiber can also make Synthroid less effective. If you eat any of these on a regular basis or drink them, check with your doctor. He may need to adjust your dose of Synthroid. You should also take this medication about 30 minutes before breakfast on an empty stomach. You should also wait at least 4 hours after taking your Synthroid before you take any calcium or iron supplements or any antacids like Tums or Rolaids. Any questions about that medication? None? Okay. All right. And we can go back at the end if you think of anything. So the next med that you should be familiar with is Protonix or pantoprazole. That's a generic name. You'll be getting 40 milligrams by mouth daily. This medication treats conditions that cause too much stomach acid, like heartburn, stomach ulcers, and reflux disease. It also reduces the amount of acid in your stomach. Some minor side effects such as nausea, constipation, diarrhea, headache, and drowsiness can occur, but are rare. You should reach out to your doctor if any of those side effects are persistent or severe. Any question about the Protonix? Okay. Now let's address your new medications that you'll be going home with. First we have Lopressor, and you may also see it called metoprolol. You're gonna get 50 milligrams by mouth daily. Lopressor is used to lower your blood pressure and can also lower your heart rate. In your case, we're wanting to lower your blood pressure since it's been consistently high. Some common side effects are tiredness, dizziness, depression, shortness of breath, bradycardia, hypotension, diarrhea, pruritus, and skin rashes. This medication can also mask signs and symptoms of low blood sugar, so pay attention to a super fast heart rate. And if you notice this, check your blood sugar immediately. And it would not hurt to go through the day and check your blood sugar several times just to see how your medication's working, including your metformin too that you're going to be getting now. Because we don't want to end up back here again with a super high blood sugar that you had. So you should notify your physician immediately if you have any blurred vision, chest pain or discomfort, or a slow or irregular heartbeat. You should avoid salty foods. If you want to lower your blood pressure, reducing sodium is an important first step as it will enhance the effects of any blood pressure lowering medications that you're taking. Also try to avoid caffeine, alcohol, and heavily processed food as they're very salty as well. The next medication you're going home with is Zestril. You're going to be taking 10 milligrams PO or by mouth daily. This medication is an ACE inhibitor and is also used to lower blood pressure, which is the medication goal in your situation. Common side effects of this medication include dry persistent cough, that is really the main side effect, dizziness, drowsiness, headache, depression, nausea, vomiting, and diarrhea. You should avoid high potassium foods such as spinach, kale, tomatoes, cucumbers, zucchini, eggplant, avocados, apples, oranges, bananas, carrots, potatoes, and sweet potatoes. That was a lot, I know. You should not use any salt substitutes with this medication, as they can also raise your potassium. You should call your doctor right away if you have severe stomach pain, with or without nausea or vomiting. This can be a symptom of an intestinal angioedema. Dizziness, lightheadedness, or fainting may also occur, especially when you get up from a lying position to a sitting position. Make sure that you know how you react to this medicine before you drive, use machines, or do other things that could be dangerous if you're dizzy or not alert. If you feel dizzy, lie down so you don't faint. Then sit for a few moments before standing to prevent the dizziness from returning. Check with your doctor right away if you become sick while taking this medication, especially with severe or continuing nausea, vomiting, or diarrhea. These conditions may cause you to lose too much water or salt and may lead to low blood pressure. You can also lose water by sweating, so drink plenty of water during exercise or in hot weather. You will also need routine labs while taking this medication just to monitor your potassium levels and your kidney functions. Any questions for that one? Okay. Finally is your metformin. You're going to be getting 500 milligrams by mouth daily. This medication is given to lower your blood sugar. It decreases the amount of glucose, which is sugar, that you absorb from your food, and the amount of glucose made by the liver. Metformin also increases your body's response to insulin, a natural substance that controls the amount of glucose in your blood. The most common side effects are GI upset, especially diarrhea. And I know that is like a super common side effect too. A lot of my other patients complain of diarrhea in the beginning, but after an adjustment period, they say it's fine. The most common side effects, I'm sorry, I already said that. More seriously, you need to monitor your blood glucose levels, as this medication could possibly drop it too low. The most common signs and symptoms of low blood sugar are fast heart rate, shaking, sweating, nervousness, anxiety or irritability, confusion, dizziness, and extreme hunger. If you experience any increased exhaustion, aches and pains, respiratory distress, increasing somnolence, wanting to spend time by yourself, and non-specific abdominal distress, you should contact your doctor, because these could be signs of a more serious condition, such as lactic acidosis. You want to avoid refined and processed carbohydrates, stuff like white bread, white rice, candy, soda, pasta. You don't want to eat any of those. Those all raise your blood sugar. So that's all on your medications. Do you guys have any questions? Okay, I know it's a lot to take in all at once, but you can always call back up here and ask for me or any of the other nurses if you get confused or want to ask questions. Alrighty? Alright, let's get ready to go home.